Good evening. My name is Vivian Ariola. I am a cancer survivor. 17 years ago, I woke up on a regular day to go to work. As I was washing my face, I discovered a bump on my neck, and I was concerned of it being there. I made an appointment with my primary care physician to have it checked out. My doctor told me it was a throat infection. I went home with a round of antibiotics that he prescribed. After finishing the medicine, I did not have a sore throat, and the bump that it was still there did not shrink. It grew. In fact, in a matter of weeks, what had started at a size of a pebble had grown to the size of a golf ball, and eventually the size of a grapefruit. My doctor was equally alarmed by the growth, so he arranged for me to see a specialist. When I went to see the head, neck, throat surgeon, he performed a needle biopsy. His reaction wasn't very good. In fact, the results from the needle biopsy were not good. I was scheduled to have an outpatient surgery for another biopsy. The location of my tumor was not far from my vocal cords. The night before surgery, I searched on the internet for the possibilities of what I might have. I came up with goiter or cancer. My friends that were trying to be supportive and encouraging claimed I could just have some thyroid issues. My fear was that it was the first ever major surgery I've had in my life, and it was so close to my vocal cords. Would I lose my voice? Would I be able to sing again? My voice was one of my gifts from God. What would I do without my voice? The thought of losing my voice was devastating. Before going under the knife, I literally made a joke to the surgeon, but it wasn't really a joke. If you cut my vocal cords, don't bring me back. He must have heard me. After I had woken from surgery, I made sure to hum to make sure my voice was still intact. Not long after surgery, I was referred to an oncologist, where I heard those words, "You have cancer." My diagnosis was non-Hodgkin's lymphoma. I had never thought I would hear those words. I did not know of any family members that had cancer. To my naivete, I thought people were more apt to get cancer if someone else in their family had it. My family's medical history read like this: you are destined to have diabetes or heart disease first. I got cancer. What I learned from my journey of treatment and others diagnosed with cancer is that you are a survivor the day you hear those words. The day I went into remission, I joined my fellow survivor sisters and brothers to continue to thrive and be an advocate for those newly diagnosed with cancer and receiving treatment. I can share with you, I am on my 16th year cancer-free. With my fellow survivor family, I have strived to continue to be a voice for continued research for cancer cures, support for cancer patients receiving treatment, education for the public for cancer prevention and screening, and for traditional integrative treatments to be available to all cancer patients. Cancer continues to be one of the leading causes of death worldwide. Cancer ranks as the leading cause of death at 591,699. Heart disease leads cancer by a narrow margin at 614,348. Following the list of causes of death, statistics show lower respiratory diseases, accidents, stroke, Alzheimer's disease, diabetes, pneumonia and flu, kidney disease, and suicide. We are currently halfway through 2017, and this year approximately 1,688,780 people will hear those words, "You have cancer." 600,000 920 of them will die in the United States. Of the newly diagnosed cases, 836,150 are men, and 852,630 are women. There has been a consistent growth of men diagnosed with prostate cancer at 161,360. Women top that with a diagnosis of breast cancer at 252,710. Between the sexes, respiratory cancer deaths, otherwise lung issues, rise at even pace at 160,420 for both men and women. In California, newly diagnosed cancers for 2017 are estimated as follows. Female breast cancer at 27,980. Uterine and cervix cancer, 1,490. Colon and rectum cancer, 13,890. Leukemia at 6,280. Lung and bronchus at 6,740. Melanoma of the skin, 18,270. Non-Hodgkin's lymphoma, 7,880. Prostate cancer, 14,520. And urinary cancer at 7,500. Those are just a few cancers to mention. There are many other diagnoses of cancer. Among ethnic groups, non-Hispanic blacks rank number one with the highest rates of incidence of cancer. Following closely are non-Hispanic whites. Going down the line, American Indian and Alaskan Natives follow, Hispanic Latinos, and lastly, Asian Pacific Islanders. I have not yet mentioned the rise of cancer incidences that have occurred for children. Leukemia tops at number one. Following that are brain and spinal cord tumors, neuroblastoma, Wilms tumor, lymphoma, rhabdomyosarcoma, retinoblastoma, and bone cancer, which includes osteosarcoma and Ewing sarcoma for cancers that affect children. I could go on with the statistics that would bore you. However, the trusted data retrieved from epidemiologist surveys and research should wake us all up to the need for the continued efforts for research for cures and treatment. The present budget presented by the current president will cut $6 billion from the medical and scientific research agencies. Such action would delay the necessary medical studies for cancer drugs. The Health and Human Services Department would be affected. Under the umbrella of Health and Human Services are the National Institutes of Health and the Center for Disease Control and Prevention. Jobs are at stake, as well as the health welfare of those that depend on the drugs like chemotherapy and immunotherapy for cancer treatment. Is this appropriate? Is this fair? A decision of this magnitude will decide if there is medicine available to treat patients with cancer. If this budget is approved, it will determine who will receive care. As a cancer survivor, I am here to tell you that cancer has a face. Cancer patients have names. I am speaking for my family and friends who are going through treatment today. Maria Jepson, Fred Schmidt, Anita Real Castro, Jason Malor, Melba Salazar, Jill Rosales, and others. They are survivors. The goal is for them to be cancer-free. We want more survivors and fewer deaths from cancer. I'm not here pleading for myself, but for everyone touched by cancer and for the future. When you make your vote on the next revision of the budget, keep the names of those that I have shared with you in mind, and those that you may know personally affected by cancer. They may be your wife, your husband, your loved one, your partner, family, your mother, father, sister, brother, best friend. We can all make a difference, and I am hoping, along with others, that your vote will make that difference for the good of all the people. Thank you. Vote wisely for all people.